okay, some external fibers like this, and some other more to the abdomen. But sometimes these are very difficult to differentiate, okay? So, if we are with an orthopedic patient, we are going to be possibly more or less in this direction, okay, with this degree of abduction, but if we are in a neuro patient, we are going to position until the maximal or submaximal stress position, okay? So in this case, if you want to palpate the clavicular fibers, you can place your fingers like this, so you will feel it clearly. In fact, you can also put your fingers like this, and you will feel like two gaps. Can you see it?
Yeah.
So this is very prominent. So these are the clavicular fibers. So it's in almost all of the patient is impossible to make a grip and do it like this. Perhaps in this patient it could be, okay? So one option could be to do a grip like this and make dry needling, but usually this is almost impossible. So usually we use a technique like this, just parallel to the thorax. So this is a bit dangerous at this moment. So we are going to evaluate this other. So we are going to palpate the external abdominal fibers. So we are going to position my hand like this, and we can be moving like teres major or latissimus dorsi, just checking according to the direction of the fibers, okay? So for example here, and I palpate here. Here there is a trigger point for me. I can palpate more. Mainly this one, yeah. So if I have to choose one, I would choose this one, clearly, without any doubt, okay? So in this case, which is the risk? The risk is to get to the thorax. So if I'm doing a pincer grip and I'm doing it properly, I will have not any problem at all, because I'm leading the needle towards my finger. So if the thorax is like this, the needle is always parallel to the thorax, okay? So the main risk is that you are doing a pincer grip and you are doing with the needle other things. But if you are with attention here, there is no problem, okay? So we are going to do like this. So another tip I was also commenting before is that in case you think it's not enough parallel to the thorax, sometimes you can grip the trigger point and you can pull a little like this. Okay, so you just pull and give a bit more inclination. And remember, always we want to do some technique like this, we try to place the needle as close as possible to the thorax, because then we will be forced to get out from the thorax. Because if we put it here, we will be leading there, okay? So this was similar, for example, if you remember the long head of triceps, teres major, okay? So we are going to put in our finger, but as close as possible to the thorax, so then we incline it in this direction, okay? So which needle I'm going to use, it will depend mostly of every patient, but
40 or 60?
I think that 50. With 5 centimeters it will be more than enough, I think, because more or less here could be 4 or a bit more. Perhaps within the fingers there is a bit less, but as I have to leave a bit of free, okay? Besides, if I'm palpating the trigger point and I'm palpating not directly here, perhaps I don't need to insert all the needle, okay? So I'm going to put another important thing, I don't know if you are also considering this, is to be as much as comfortable you can. So sometimes I saw only in the main group people bending or twisting like this. So you also have to think that you have to work a lot of time, you have to be precise, so you have to be relaxed. Okay, so try always to think that.
¿Qué aguja quieres de palpa?
Dame de 50 por si acaso. ¿Hay de
Sí.
50?
Sí, ahí, pero...
Si no, cogemos... Es que igual se queda un poquito corta. Sí. Para él sí. Does it happen in the women's group, this also, about ergonomy or not? Sandra, les va diciendo cosas de que estén relajadas, se den apoyo.
Lo que puedo.
Okay, so I'm going to palpate. I think this one could be. Okay, so in this case, what I'm going to put is the needle here, a bit closer to the thorax, and then more or less.
The position before you insert it.
Yeah, like this. Can you see it?
Okay.
So my finger is here, so this is the direction. So it's parallel to the thorax, or perhaps even it's going far from the thorax, okay? It's fine now? I can start? Okay, so I insert it. So I'm going to do a first insertion, very gentle, it's very stiff. Very, very stiff here. Okay. Here, everything is fine. I'm going to move a bit more lateral. Here. Do you feel some twitch?
Yeah, I feel.
Okay, I'm not going to do more.
Yes, I can feel.
This was really stiff, so this can be very painful. So take a bit of care with your colleague. Did it refer pain to any place?
Slightly, yes. No, it didn't go all the way, but